Again, welcome back, everyone, from the summer break. We are thrilled to have Dr. Del Rio joining us um, today for Grand Rounds. He is our Cliff Saul's Distinguished Professor of Medicine here at Emory and Professor of Global Health and Epidemiology at the Rollins School of Public Health. He is the Chair of Medicine, as we know, and is the first graduate of our residency program to hold that position. He's a graduate of LaSalle University in Mexico City. First came to Emory as a visiting medical student back in 1982 before finishing his residency and ID fellowship here and joining faculty in 1996. Global leader in HIV research and policy. His research focuses on early diagnosis, access to care, engagement and care compliance, antiretrovirals, and the prevention of HIV. He is a member of multiple societies, including National Academy of Medicine, as well as becoming the International Secretary for the National Academy of Medicine in 2020. He's also a member of the American Academy of Arts and Sciences. He's a recipient of numerous prestigious awards, including the Thomas Jefferson Award here from Emory, the highest award conferred by Emory to faculty or staff who significantly enriched the intellectual and civic life here at the Emory community, as well as the American Public Health Association Award for Excellence in Public Health. Locally, he has won the Phoenix Award, the City of Atlanta's highest honor for his medical guidance and support during the COVID pandemic, and more recently won the 2024 James Shepard Lifetime Achievement Award from the Georgia Hospital Association, as well as more recently achieving mastership with the American College of Physicians and receiving their John Phillips Memorial Award for outstanding work in clinical medicine. So thank you for being here today, Dr. Del Rio, to talk about the Department of Medicine.
Thank you, Annie, and welcome everybody. Welcome to our inaugural Grand Rounds for this academic year. I wanted to use this opportunity to, look back into this year that this is my first year as chair of the department, and I'll start by stating that, see, my slides are not advancing, that it's been quite a year, hasn't it? And I think we will all have to acknowledge that this has not been an easy year. And let's do a little bit of a recount of all those external factors that have influenced us in a significant way. Yes, January 20th, President Trump began issuing executive orders. So far, 198 executive orders have been issued by the White House. There's actually a website where you can follow them. Uh, it's almost hard to keep track of them. But the ones that to me were very significant that day, it were three. Number one was an executive order abdicating the role of the U.S. in global health and public health, and a reduction in funding for essentially leaving WHO. And those were obviously very significant. The second one that impacted us quite a bit was an executive order defunding programs related to health equity in the U.S. and abroad on the basis of race, religion, ethnicity, gender, sexuality. This executive order ending radical and wasteful government DEI programs and preferencing, and defending women from gender ideology, extremism, and restoring biological truth to the federal government, who that did that. And again, they had significant impact in our work. January 31st, a few days later, Dodge began deleting data, and a lot of that data that we used to rely on in a significant way went away. And the data impacted were primarily around HIV, Mpox, women's health, LGBTQ plus health, youth mental health, and yes, the ACIP recommendations as well. By February 3rd, we said goodbye to USAID. As Elon Musk put in this tweet, we spent the weekend feeding USAID into the wood chipper. I could have gone to so many great parties, did that instead, and he actually boasted about how great a work this had been of destroying USAID. And USAID is very significant because it's a major implemented partner for PEPFAR. It runs childhood vaccination programs in many countries in the global south. Global clinical trials for new vaccines frequently occur through USAID, had global access to essential medicine, surveillance, and significant infrastructure and capacity building throughout the world. By February 7th, a Friday, we got the news that the administration was capping the F&A rate at 15%. This is, again, the so-called indirect rate. This is the amount of money that comes attached to your grant as a way to support the infrastructure that is in our universities. Negotiated rate depends by the university. It's an individual negotiated rate, but it's around 50% roughly across the board. And so taking it down to 15% was quite significant. February 13th was the also the when the Maha era began. The U.S. Senate confirmed Robert F. Kennedy Jr. as Secretary of Health and Human Services, and really that established the president's Make America Health Agenda Commission, and led to significant changes subsequently to CDC, to NIH, the FDA, and CMS for the major agencies that have to deal with us and that are under HHS purview. But also right after that appointment of the secretary was the what I call the Valentine Day Massacre, in which nearly 10,000 employees from this agencies were fired. And since that time, approximately another 10,000 employees have lost their jobs due to early retirement. Then grant terminations began. Usually, just to give you an idea, about 15 grants a year are terminated for at the most. And since the grant termination began and through a couple of weeks ago, there have been close to 1,500 grant terminations. So that's a hundredfold increase in the number of grant terminations that we are seeing. And this was very directed uh, and very significant. And many of them were around areas of DEI, gender minority, vaccine hesitancy, sexual minority, mRNA vaccines, anything that had to do with China, climate change, gain of function research, international research. And yes, South Africa was called out, and no new grants or enrollments in clinical trials through the networks were allowed into South Africa. I personally had a grant that had to do with vaccine hesitancy, and that grant was gone. And some grants also related, anything related to LGBTQ health was also gone, but also other activities around LGBTQ health, not only just grant, but many other things. Um, this of course started extending beyond this. We also saw a decrease in funding related to chronic diseases. We saw it related a drop in funding for clinical trials in Alzheimer's and many other things. So the words we used to identify the grants were not very specific, and sometimes mistakes were made. I call your attention to this letter published in JAMA in May of this year, a characterization of research grant terminations at the National Institute of Health. At this point in time, there were about 700 grants terminated. Uh, the National Institute of Mental Health was the number one institute where grants have been terminated. National Institute of Allergy and Infectious Disease was also quite significant. And 57.6% of the were research grants, but 20% were training grants. So the impact on early career investigation, early stage investigators was significant. And if you read this letter, Emory University specifically called out because we were in the top list of universities that had grants terminated, primarily because of what we do in our areas of expertise around vaccine, HIV, etc. As I said, the impact on ESIs is quite significant. Of the grants terminated, about 38% were training grants. Yet the dollar impact, because those grants are very small, was less than 20%. So again, a significant impact in early stage investigators that had F31s, R25s, T32s, T34s, K99s discontinued as a result of this. And the major ones were F31 and R25s. So what was the story here at Emory? Well, this slide is almost now almost 3 years old, but there were about 100 grants terminated, of which 32 of them were in the School of Medicine, 21 as prime, and 11 as sub-awards. And the subject areas are the usual suspects: HIV, COVID vaccines, treatment, diversity supplements, DEI, LGBTQ, and training grants. And the financial impact was about 20 million in funding to date, lost by the School of Medicine and Research, and this impacted about 65 people. None of them lost their employment, but there was significant redeployment of staff. When you got your grant cancellation letters, you also had, I would say, received an email canceling this grant that was quite significant and I would say very hurtful. For example, if your hand got to do with DEI, it said this no longer effectuates agency priorities. And it said things like worse, so-called diversity, equity, and inclusion, i.e. DEI, studies are often used to support unlawful discrimination on the basis of race and other protected characteristics which harms the health of Americans. Similar things around gender. Vaccines, for example, that said it is a policy of the NIH not to prioritize research activities that focus on gaining scientific knowledge of why individuals are hesitant to be vaccinated and or explore ways to improve vaccine interest and commitment. Again, things that really were hurtful and quite frankly did not make any sense. Uh, as a result of this, federal funding for medical research really slowed down nationwide. You can see here the amount of grants awarded during Biden through this time in 2021, Trump in 2017, Obama in 2013, and you can see where Trump was in 2025. And this was a combination of not only new grants not being funded, you can see a significant drop in new grants being funded, but also renewals of existing grants not being funded. And frequently were not because uh, they were discontinued. It was because the NIH had lost so much staff. There was not the staff at NIH to put together the notice of awards and get them out and simply get the grant wrapped and ready to go. And that led to significant lag in spending by NIH. The other thing, of course, that has happened is that Trump has come after many of the universities, especially Ivy League schools. We know the case of Harvard, Columbia, Northwestern, and many others that have been impacted and have had their grants completely frozen for a variety of reasons. The primary reason being called is the anti-Semitic activities in those schools. The president's budget also was quite significant. The president budget requested an 18.1 billion reduction in NIH funding. It took the NIH funding from 46 billion in FY25 to 27.9 billion in 2020 and 20 FY26. And it restructured the NIH from 18 to 8 Institute of Centers. And again, it continues. You hear this over and over, that the NIH priorities were to improve population health, reproducibility and rigor, innovation and collaboration, research safety and transparency, and academic freedom. They all sound great, except that, that was not what we were seeing at the level of the awards. But there has been some hopeful news. Federal judges have been very important in putting injunctions that have stopped many things, including the order to decrease the F&A rate, and they have reinstated many grants. I myself have had a grant reinstated as a result of one of these actions, and but also the Congress has played a significant role. You can see here that Congress, both Republicans and Democrats, have worked together to maintain the NIH budget. You can see here in red what Trump requested for the agencies. You can see the NIH total decrease significantly and how much it was decreased across different institutes. And you can see what the House and then the House in yellow and then the Senate bill in blue and finally in gray what the final decision was. Not only was the NIH budget uh, approved by Congress, not only stayed the same or reversed the cut proposed by the administration, it actually increased the budget a little bit in some areas. Similar thing happened to CDC. CDC was significantly proposed to the administration was to cut CDC quite significantly. You can see in red what the proposal was and how much was being cut in global health preparedness and response, in global health and other activities. And you can see what happened as a result of what Congress did and how it was increased. And again, this was a significant win when the Senate rejected the cuts that the administration had proposed for CDC and NIOSH. So if you look at the budgets, here is FY25, a complicated table. You can see the agencies that we care about. You can see the FY25 budget. You can see what was being proposed by the administration in red. You can see the significant cuts of everything is in the negative 30 to 40% cuts. FDA was the only one that really didn't have any significant cut. And you can see what the Senate Appropriations Committee approved. And at the end of the day, what happened, again, you see that most agencies did fine. In fact, the one that lost the most of the ones we care about is FD, AHRQ, but you can see there overall this was a significant gain on by Congress, and want to make sure that you appreciate the work done by both Democrats and Republicans in this respect. Uh, but there's other options that the administration had. On August 5th, Secretary Kennedy canceled near 500 million in mRNA vaccines, or vaccine research and vaccine contracts. And much of that work was being done here at Emory, including a large ARPA-H grant that, of course, as a result, it got canceled. And finally, August 7th, the executive order said improving the oversight of federal grant making. Basically, what it means, if you read this executive order, is an ideological review of grants. Then we need to acknowledge August 8th, when a gunman started shooting over 500 rounds of ammunition into CDC. And August 27th, when the CDC director, who had only been there for a month, got fired when she refused to comply with with orders to block access to COVID vaccine. So yes, many in our faculty, there are adjunct faculty members that are also employed at CDC. We have faculty members that have spouses and loved ones that work at CDC. And I think we need to really stand together with CDC. Not only are they our neighbors, they're our colleagues, and they're critical. Emory is different; it's a different institution because of our relationship with CDC, and we need CDC to be preserved. We need CDC to continue being a strong institution. Uh, the final thing that has happened, of course, and we talked about it in leadership meeting this morning, was the Emory interim president, September 3rd, ending DEI offices and programs, and what the implications of that are going to be. We're still not sure, but obviously this will have an impact in our department as well as in the School of Medicine. So it's been a difficult year. Uh, But as Michael Chang, who was a tennis player who won major tournaments, said, "But I still look at every day as a new opportunity," and I feel exactly like that. I think we all need to be resilient, and even though the road has been difficult, we need to look at every day as a new opportunity and move forward. And if you're going to remember one thing about this Grand Rounds, I'll give you five good things to remember about what has happened in the Department of Medicine this past year. The first thing is that research awards for FY25 passed 200 million for the first time. And again, we don't have final numbers, but that would be a 34% increase from FY24. The Department of Medicine faculty also increased from 870 faculty to 923 faculty during this fiscal year. And you can see the divisions with the largest increases being hospital medicine, digestive diseases, cardiology, and infectious disease. So we are close to having over 1,000 faculty members. We launched the medicine pediatric residency program. We opened a dialysis clinic in Greenbrier, and and there was a very generous gift received from the O. Wayne Rollins Foundation and the Gary Rollins Foundation to expand the Academic Internal Medicine Center. And it really will be transformative in our general medicine division. So five really good things that happened this past year. So I'll give you some highlights around research. This is what has happened. In blue, you can see proposals. In orange, you can see awards, and compares fiscal year 24 to 25. So the year before to the year that just ended. You can see proposals went up 30%, but awards went up 34%. So the faculty submitted more grants, but also we got more grants funded. You all got more grants funded. And this is a big, big uh, uh, success, especially in this environment. There were many research awards that are notable, but I want to mention 10 new R01s, and you can see who the recipients of these R01s are, and their name and their divisions and the name of the grant. Two new K24 awards. I want to pull out Cecile Lahiri and Russell Kemper in ID. These are two K24s, very important grants. These are mid-career mentoring awards, and these are the only two we have in the Department of Medicine. So again, congratulations to both Cecile and Russ for this award. We do want to increase the number of K24s we have. And there were also three new K23 awards. But there are other major research awards. I want to call out Nadine Rufal, who received a PO1 to study influenza transmission, and Cecilia Lahiri, who received the renewal of the Emory Score program. Both very important grants that are very large and quite significant. Now, it's not only grants. What makes an impact is the research that then transforms and improves the health of Americans. And I want to mention two of those. Uh, Dr. Asiro Kashariari in rheumatology led a phase 3 trial that has been used for the FDA approval of imeblizumab, a drug that is the only approved treatment for IgG-related diseases. And this was a publication in New England Journal of Medicine, and then an approval on FDA drug. And Dr. Colleen Kelly led the Purpose 2 trial for the HIV prevention that has been used by the FDA to approve a drug called lenacapavir for PrEP. This is a twice yearly injection that essentially produces 100% protection against HIV. Again, a publication in New England Journal of Medicine that Colleen was the lead author, and FDA action based on this trial results. So two important contributions in which advancing care for patients leading to FDA approval of drugs started here at Emory. I also want to mention other very large awards that are non-federal, and you can see them listed here. Anish Mehta in infectious disease, Yun Sub Yoon in cardiology, Iñaki Sanz in immunology, Nadine Rufel in infectious disease, Valeria Cantos in infectious disease, Javier Goshan in rheumatology, Vibha Lama in pulmonary, and Greg Dornhorst in infectious disease. All of them received grants outside of NIH, non-federal awards to advance research. We've had a lot of publications this year. We haven't finished counting the publications, but I'm highlighting 14 publications here that are high impact, notable publications that really, again, are in major impact journals, JAMA, Circulation, Nature Communications, Annals of Internal Medicine, New England Journal of Medicine, uh, Science Translational Medicine, uh, Nature Immunology, Nature Communication, Nature Medicine. All of them have been important papers that have come out of investigators at our institution, in our department. Congratulations to all of them. How about faculty development? What is new? Well, faculty development is very important because at the center of all we do, whether it's education, clinical care, research, scholarship, is this whole idea of faculty development, that the goals of faculty development are career satisfaction, engagement, representation, support, and elevate us, what we have called RISE for a long time. But so really, faculty development is about professional and personal development. So what is faculty development doing to improve professional development opportunities? Well, this is about improving academic productivity, career satisfaction, and professional fulfillment, a motivation to succeed, and this sense of belonging, this inclusivity, community, and belonging that is very important. And at the end of the day, I see all this as important in retention and wellness. And we frequently talk about wellness, and when we say, what are we doing for wellness? No, we're not doing yoga, at noon. We're doing other things to improve people's sense of belonging, productivity, academic productivity, career satisfaction, motivation to succeed, and community and belonging. Um, Probably the most visible work that the faculty development group does is promotions and tenure. And I want to highlight this because this was quite a year. We had 31 approved promotions and 2 grants of tenure. Of those approved promotions and grant of tenure, 32 were women and 21 were men. And there were 2 professors with tenure, and both were women, 18 professors, 31 associate professors, and again, 14 women were professors and 4 men. 15 women were associate professors and 16 were men. And they're currently working on 4 appointments and 27 associate professor and 1 professor promotion. So in general, in total, they have reviewed close to 70 packages this year. This is a lot of work. And again, thank Dr. Cribbs and her committee and her team for the work they've done because they're succeeding in promotions, they're succeeding in putting packages together. It's actually considered an example for others. We have continued working on clinical distinctions. This is an important program to recognize people for their clinical work. And there are 3 ranks: senior physician, distinguished physician, and eminent physician. And you can see the number of distinctions we had: 31 as senior physicians, 17 as distinguished physician, and 9 as eminent physicians. And the Department of Medicine now has more than 400 of these distinctions awarded. Mentoring is a very important thing that is done out of faculty development. And again, it's about not only mentoring early career faculty, but really mentoring throughout your career through peer mentoring, through resources made available. And in my sense, my plea to everyone, if you don't have a mentor, find one. We all have mentors. In order to succeed, mentors are important. I have mentors. I continue to consult them, to reach out to them. And mentors are a critical part of your career and your succeed in academic medicine. And I want to remind everybody that we are having next Thursday our honors and awards celebration. We had 104 faculty awards nominations and 50 staff nominated for awards. So please, please, if you can, come in person. It will be a wonderful evening. I want to, however, highlight a few of the awards that I think are quite significant. Ikho Fotokun in infectious disease was inducted into the National Academy of Medicine, a huge honor. We have very few members in the department. But he also received the Maxwell Findle Award for scientific achievement from the National Foundation for Infectious Disease. Camille Vaughn graduated from ELAM, and Divya Gupta graduated from ELH. And Vince Marconi received the John Blair Barnwell Award from the VA Health Administration Office of Research. This is the #1 award nationwide for people who do research out of the VA. So congratulations to Dr. Marconi. Karen Law received the Provost Distinguished Teaching Award, and Jen Spicer received the Evangeline Papageorge Distinguished Teaching Award. Greg Martin received the Emory Woodruff Health Science Center Voice of Health Award. And 4 faculty members, including myself, but also Drs. Bussy Jones, Higgins, and Manning, were promoted to Masters of the American College of Physicians. 50 people a year approximately are promoted to Masters. This is an association of over 120,000 individuals. There was no other institution, no other department of medicine in the country, in the world, that had 4 people out of the 50 people this year. So we're about 60 this year. 4 were from the Department of Medicine here at Emory. So again, a huge achievement. Jada Bussy Jones was also the president of the Society of General Internal Medicine, a major job that she did throughout the year. And Oguchi Oganuma was selected by the Atlanta Business Chronicle as a 2025 healthcare champion for the work she's done to promote an age-friendly healthcare across the Grady Health System. Dean Jones was recognized with the Lifetime Achievement Award from UL Research Institute, and Joanna Bonsall received the Society of Hospital Medicine 2025 Clinical Leadership Award at the national meeting, and Dustin Smith received at the same meeting the Excellence in Teaching Award. And Guillermo Pierres in endocrinology achieved Masters of the American College of Clinical Endocrinology and also received a Lifetime Achievement Award during the International Diabetes and Endocrine Conference. So a lot of awards, more to come on Thursday, but again, recognizing that our faculty is being recognized for their work locally, nationally, and internationally. I want to go now into education highlights. What's our goal? Our goal in the Department of Medicine is to train the next generation of healthcare leaders who are committed to clinical excellence and intellectual curiosity, with enduring dedication to service and the privilege of patient care. That's what our mission is. That's what we do in the Department of Medicine around education. And we train healthcare leaders by providing, by doing many things. And examples of this, you can see in scholarship. Last year, our trainees presented more than 90 posters at national meetings, and you can see the meetings there. And 5 presentations, including an oral presentation, were at the upcoming American College of Gastroenterology in October. And these presentations happen because the faculty work with the residents to get them ready in their research to make those presentations available. There are a lot of clinical opportunities for clerkships, for residency programs. 24 fellowships are the footprint of the Department of Medicine and Education. And each year we have at least 600 learners rotate through our training environments. And we do pretty good. This year we have 40 medical students applying to medicine or medicine psychiatry or medicine something else, medicine pediatrics, across the from the School of Medicine. So that's a really big number. And over the past 5 years, 71 residents stayed at Emory for fellowship, and more than 60 Emory residents and fellows were recruited to join the faculty. So I look at our residents like our bench, like our feeding teams in the major leagues. These are the people that we're grooming to be our next fellows, but are more importantly our next faculty members. And nothing gives me more pleasure than seeing somebody who we recruited as a resident. Marco Schechter sent me a note some years ago, last couple of years ago. He said, you offered me a residency program. He ended up going to Hopkins, did come here for fellowship, but he stayed here on faculty, and he said, now you're signing my letter of promotion to associate professor. And again, nothing gives me more pleasure than seeing our residents, our fellows, to then become faculty and become successful. And that's why the placement of our fellows, our residents into fellowship is critically important. And it's really hard. They're very competitive, cardiology, gastroenterology. But again, you can see how well we did. And we do well because of the work that you as faculty, you as division directors, you as members of the education team do to ensure that our residents are well received and are well ranked out of their programs. We have had a lot of faculty innovation in medical education. Uh, I want to call out Lashmi Tumala and Dimitri Casamatis that have revised the preclinical cardiovascular pathophysiology course to improve participation in critical thinking. And their new approach will really be part of the new curriculum being launched in 2026. We have improved student feedback. Anna Vaughn and Richard Pittman have designed really a great way to give feedback across 4 fellowships. We have leaders in accreditation. Jason Brown and Bhavin Arjun are coordinating the quality improvement response to the LCME site visit. We have people working in scholarship and assessment like Robin Klein, Rina Harmajani, Jada Bussy Jones. Uh, and then, we have the first internal medicine pediatrics combined program in Georgia, and this was a huge lift. And Katie Gilson did this, and really with her team, and really it's great to have received in July of this year the first class of MedPeds residents. Because of funding from the School of Medicine, we have now funding coming to program directors and core faculty. And you can see they're listed. I'm not going to mention them. You can see the names of people that are receiving funds so they can be dedicated to teaching. So when people say we don't support teaching, we don't value teaching, we don't give money for teaching, this list of individuals is proof that we do give money for teaching, we do support people for teaching, we do provide protected time for teaching. And this is, again, very important to the mission, is not only that we talk about it, that we actually do it. And we have been able to also have our faculty work on projects to improve the curriculum, to do ultrasound and echocardiography training, to do medical education, you name it. I mean, a lot of scholarship programs that are being led by the faculty to do scholarship around education, because education in academic centers is not just about teaching, it's about the science of teaching and improving teaching and evaluating teaching and really producing the scholarship of teaching that I think is really critically important to transform education nationwide. So quality is a major focus of what we do. And the outpatient priorities in quality have been about diabetes control, hypertension, and message management, that inbox that is driving everybody crazy. In the inpatient area, VisNet quality is what we're following. Uh, you know, Ina Flores and Guillermo Pierres in endocrinology have developed a continuous glucose monitoring in diabetes management that has been recognized, has been presented at national meetings, and it's really how to use technology to improve patient outcomes and improve hemoglobin A1C control. And we have partnered with Wellbe Health to do blood pressure home monitoring. And this something feeds directly into Epic. It's already rolled out in 3 of the primary care clinics. And the next step is to roll it out to many other clinics across the system. And we're doing quite well in quality. And I want to call out the work of Chris Massey in leading our quality initiatives. But you can see that we are in the green for both diabetes, hemoglobin A1C control, hypertension control, and pneumococcal vaccination rate. And all those are really important. We are not only taking care of patients, but taking care of our patients with quality and achieving the goals that we have set out. Message management is a major area that we're working on. There was an innovation grant that was won by Rima DeBook and Pam von Vahora, and they're working together to really create this intervention to improve message management through an LPN message management, augmented response technology. And again, the goal is to reduce message volume to providers by 20% and as a way to reduce burnout. We'll have the results from that for later in this year, but I think that's a really important initiative. Um, you can see in the inpatient setting, this is data from Grady, and this is data from a year ago. It's not the most recent data. But you can see in green is good and red is bad. We have, more green than more red than I wish we had, but we're still making improvements in those critical components of mortality, safety, length of stay, and again, not making a lot of progress in 30-day readmissions. But our teams are working very hard to improve these outcomes and to improve care of patients, not only in Emory Healthcare, but also at Grady. At Emory Healthcare, we have a ways to go in improving also our metrics. It's not like Emory's doing great and Grady's not. We all have room for improvement, and therefore we need to be engaged in improving these metrics. And this balanced scorecard out of Visnet is something that will become available very quickly and something we can look at. But again, the goal is that we see more green than you're currently seeing. We're not where we need to be, and we need to work at improving our uh, our quality rankings. Let's go now into specific division highlights. And again, I want to thank the division directors and administrators for sending me things to pick. I picked the ones that I wanted. Some have already been highlighted, but I'll highlight a few others that I was uh, quite proud of. I want to start by highlighting the career of Dr. Melody Palmore. Melody is a dear friend and colleague. She has worked for many years. She started the women's program at the Ponce Clinic. She she worked with to create a home for women with HIV, dying of HIV, the Gift of Grace. She's worked with Living Room to provide housing for people with HIV. And again, her work really embodies the mission, the values, and goals of the ID division, and the retirement melody will be felt by many, but more importantly, will be felt by her patients. But we wish her well in her retirement. Um, I want to highlight this letter. This letter was published in New England Journal of Medicine in 1993, and you can see the two authors of the letter were Monica Farley and Phyllis Kosarsky. Those two women, Monica was the division director, recently retired, were the two first women professors of medicine in the division of ID, and I probably, one of the few professors of medicine in the School of Medicine. And they published in 1993 this letter talking about sexual harassment and medical training and how it was really hard to be a woman. I want to tell you that we continue to make this a priority. We have a zero tolerance for sexual harassment, and it really makes me incredibly happy that we're seeing women faculty who are being successful, being promoted, achieving ranks of associate professor and professor, and made me give me a great joy to see that back then there were two women in ID who were leaders and who were trailblazers. Well, this past Friday at the home of Lila Walk Coburn, nine new women in ID got together. One was a professor with tenure, our interim division director, and Andy Sheth. One was a Latina woman, and one was an African American woman. Again, we're seeing significant improvements in gender in gender equity across the promotion to the high ranks of academic medicine at Emory in the Department of Medicine. Uh, this is where we rank. This is where the School of Medicine's rank in in promotion of minorities, both men and women. And again, we have work to do in this area, and we will continue to do it. This is not about DEI. This is about simply doing what's right and promoting people for their merits. In the division of geriatrics, Madeline Hackley, who was also promoted this year, and Laura Emery, in partnership with the Science Gallery Atlanta, are evaluating a group approach called the Approach Showcase. And this, again, is funded by the National Endowment for the Arts. It's a combination of dance and to improve health, to improve Parkinson's disease. And really, it's a great collaboration of how the arts can improve health, and really something that I think it's pretty significant, and we need to all know and be very, very proud of and excited about. In pulmonary and critical care medicine, Viva Lama has really taken the initiative to launch a comprehensive lung center, and this is key because it's a foundation to grow our programs in chronic lung diseases, but more importantly, improve lung transplantation. And Lorenzo Safari has taken the reins of the lung transplant program, and the number of transplants has increased significantly to a new height from what was pretty low in years before. And I want to highlight John Severansky, who was appointed the editor-in-chief of Critical Care Medicine. This is really the premier journal in the specialty. In rheumatology, the new comprehensive CART program for the treatment of autoimmune diseases. They have done 3 clinical trials around lupus, scleroderma, and myositis. They have received a Lupus Research Alliance Award to understand immune resetting after CAR treatment, and uh, and they've launched the Myositis Clinical Trials Consortium, a network of more than 950 members over 70 countries, looking at myositis and how to improve care of those patients. In hospital medicine, both Justin Smith and Joanna Bonsall gave the update in hospital medicine, and they also gave it for us at Grand Rounds. But this was a really unique for the first time in the history of the Society of Hospital Medicine. The presenters of this highly important presentation, this highly coveted opportunity, were from the same institution. And if you recall, when they did it for Grand Rounds with us, it was also fantastic. In digestive diseases, they have expanded their basic science research program, and they have also expanded the clinical faculty with 17 new hires. And Dr. Ray Kim has been hired as director of the GI Clinical Service as he started August 1st. And again, we're looking forward to having Dr. Kim work closely with Dr. Starman and her team to really expand our clinical footprint in gastroenterology. In renal, Fred Robbery obtained the designation of Polycystic Kidney Disease Center of Excellence for Emory. This is a very important designation from the PKD Foundation. In Sana Wahid and Janice Lee were reappointed to the ABIM Nephrology Board, and Park was appointed as Associate Chief of Research at the VA. And you can see pictures here of the dialysis clinic at Greenbrier that was open earlier this year. Again, a beautiful facility and really the place to take care of our patients in the best possible way, where the clinic is close to where the patients are. In endocrinology, there's a type 1 diabetes QI Collaborative Best Team Award that was won by Dr. Davis, Pascal, Zimmer, and Hall. And Jason Snyder in General Medicine and Sonia Hall in Endocrine had a publication that has been highly cited out of one of the publications produced at Grady that has been highly cited. I want to highlight that Dr. Nanette Wegner recently celebrated her 95th birthday, and she's still clinically active. Nanette, for those that don't know her, is an Emory legend. She has been an icon of Emory at Grady since 1958. I had the privilege of working with Nanette as a visiting medical student, as a resident, as a fellow, as a faculty, and again, as one of the people that I continue asking for advice. She's a pioneer in cardiovascular prevention and a champion in cardiovascular health of women. She's a role model. She's a mentor. She's a selfless mentor, and she has a large number of publications, over 17,000 publications, and numerous national and international awards. So congratulations, Nanette. You are the heart and soul of our division, our department down at Grady, and many places. But cardiology, other things have happened. Mike Dangerfield has made a bequest of over $8 million to support cardiology research. Cardiology has close to 500 publications in this fiscal year, 122 active clinical trials, and they continue to be seek as a destination place for residents who want to do a cardiology fellowship. Over 1,000 applications this year for about 8 to 10 slots. And they hired 20 new faculty this year. So again, expansion of clinical service. And I want to call out and congratulate Dr. Taylor, who submitted the CTSA, the Clinical Translation Science Award, non-competitive renewal. This is an over $11 million award for this grant year 9. And many places there were no cuts. Most CTSAs have had significant cuts. And this is the largest school of medicine grant this year. So congratulations, Dr. Taylor. In general medicine, a teaching scholarship school-wide is something that general medicine faculty do. We already talked about the School of Medicine Dean Teaching Award, but the School of Medicine Dean Teaching Award in 2024, the General Medicine Division had two of the six School of Medicine wide awards. Baveen and Jason received those. And in the 24 years that the School of Medicine Dean Teaching Award has existed, 21 awards, so 11% went to general medicine faculty. And there's been a recipient of general medicine recipient in 20 different years. And I want to highlight Lisa Bernstein, who is the most repeat School of Medicine Dean Teaching Award. She has had three of those, 2001, 2007, and 2018. So congratulations, Lisa. In career development, again, we mentioned the gift from the Wayne Rollins Foundation, the Gary Rollins Foundation, an $18.5 million gift that will allow to award two faculty members Rollins Career Development Awards. This is going to be a 3-year award to support their K to R transitions, to extend the General Medicine Faculty Development and Promotions Committee. Danielle Jones lead this, has done it at Grady for many years. We're going to extend it beyond Grady and to do many other things. So thank you for the Rollins Foundation. This gift is really transformative. And again, they do a great job in the primary care area. 2 of the 20 Emory Healthcare faculty members were recognized for 99 percentile in press training satisfaction. And this are Paul Bird and Deepa Vashir. So how about going forward? Let's talk the last 10 minutes about what do I see for our future. As Andrew Grove, a former chairman of Intel, said, every company faces a critical point where it must change dramatically to rise to the next level of performance. If the company fails to seize the moment, it will decline. The key is courage. And I feel the same way. The department, the school is facing a critical point where we need to change dramatically to rise to the next level. And we have to seize the moment. We have to move forward. But the key to move forward is courage. The NIH director has recently published what he sees as his priorities. I'm not going to read them. I'll leave them there so you can read them and you can look at them. But again, it's going to be about how do we position ourselves to respond to the priorities of the NIH? How do we ensure that we're going where the money is, responding to priorities and really continue to advance the science the way we need to. And the NIH director has ordered a secondary review of grants to outline, to make sure that they are aligned with the top research priorities. So this is going to be more than just the grants going to study section. Then they'll have to be aligned to these priorities that I mentioned before. So we need to be familiar with these priorities. We need to read them. We need to be able to be conversant on them, and we need to plan about how to succeed in them. Again, like when Wayne Gretzky said, it's not playing where the puck is, it's playing where the puck is going to be, and we need to be there. This year, we had an external review of the Department of Medicine. We hadn't had that one in years. And I want to thank everybody, but particularly Kathy Grinling for leading and her team for leading this effort. I think despite the fact that we have to do it on Zoom, I think it was a successful external review. The external reviewers included 3 peer chairs, Vinette Chopra from Colorado, Anne Marie Lennon from Pittsburgh, and Gary Deshear from Yale. And they highlighted the strengths of our department, and I think they were right on the money. It's a collegial, collaborative, supportive culture that is focused on people and helping everyone succeed. An extremely strong commitment to the clinical education of trainees, including the internal medicine residency and various fellowships. A strong commitment to excellence in clinical care delivery and patient outcomes across 20 unique sites in Atlanta and in Georgia. A large research portfolio that is about 40% of the School of Medicine and NIH funding. a newly appointed chair, and a large clinical enterprise that expands multiple sites. But they had also key recommendations for us, which are, you can see them here, is improving communication and transparency on funds flow, manage the why of various processes, allow flexibility in recruitments, clarify the role of the Faculty Development Council, continue efforts or simplifying the governance, organize a research retreat to prioritize and focus on the academic mission and ways to support and protect time for clinicians to engage in education and innovation and in research. So, what are our next steps? Well, to clarify and communicate funds flow, we're going to launch a financial transparency initiative. And this is going to include town halls, visual dashboards, clear messaging, templates to really explain our budget decisions and many other things. To streamline governance and site integration, we're going to develop a unified governance framework with clearly defined roles, decision pathways, and integration points across all clinical and academic sites. To prioritize faculty engagement and burnout, we're going to invest in burnout prevention strategies, including protected time, recognition programs, and support for faculty and staff well-being across all missions and sites. To strengthen leadership, recruitment, and flexibility, we're going to implement a flexible and accelerated recruitment pathways, probably through a committee that will help us in key recruits for key leadership roles, including translational support and clear authority for interim leaders. We're going to enhance our research strategy by organizing a research retreat and launching a strategic plan for research focused on diversification, improvement of clinical trial operations, and identification of novel initiative across divisions and initiatives and identifying new funding opportunities. And for building longitudinal and faculty development and mentoring, we're going to create a structured and longitudinal mentoring and development roadmap, and we're going to continue to support and redefine faculty development council and a cross-site leadership support. And we're going to ask ourselves some critical questions. Why do we exist? How do we behave? What do we do? How do we succeed? What is the most important thing for us to do right now? And who is the person that needs to do each one of those things? And I think by doing this, we'll provide more clarity, more directionality, and more ways in which the department will continue to be successful in this challenging times. So here are my closing thoughts. Dr. Manning, when we were talking about what's going on with DEI, she said to me, "This is not about renaming. This is about reimagining." And reimagining the future is exactly what we need to do. To me, this doesn't mean abandoning who we are, but rather leaning into it, knowing our identity is strong and steady, and doing that as we adapt and grow. I was listening to Secretary Kennedy hearing confirmation the other day, and that made me reflect on our nation's history of the importance that academic medicine has had for health, for advancing science, and for improving the care of people across the world. And why are we here as professionals, as scientists, as clinicians, as educators? And I would tell you that we have always faced the unknowns, and we have always responded with courage, learning and refining over time. So we're like an aged wine. We not only deepen what we strengthen. So again, we should not be worried. We should have courage. We should do what we need to do. And again, the top line is clear. We cannot always know what's ahead. It's going to be challenging. We may not know what's ahead, but we do know who we are, and we're guided by our tripartite mission of building science, strengthening service, elevating education, and it's all rooted in resilience. So I think about the Department of Medicine. At the core of our department is what I call the triple G of the department, which is with grace, with gratitude, and with grit, we will continue to reimagine the future and create it together side by side. And as the Department of Medicine, we are ready for what comes next, not by changing who we are, but by growing stronger together. So thank you for being the Department of Medicine. Thank you for being in this grand rounds, and I look forward to working with you through this year.
Thank you, Dr. Del Rio. That was fantastic. We really appreciate your summative review of things, both what has happened and where we are going. What questions or reflections do folks have?
And again, I told Annie that I have to check with government relations before we can post this in YouTube. But I wanted to be very clear about, I want to acknowledge all the pain that people have gone through, and I want to really say that we need to be together at this time. This is challenging times, but at the same time, it's an opportunity to really build the Department of Medicine family to support each other and to move and to get to a better place by working together. So use this external challenge as an internal opportunity for alignment, for growth, and for development. Well, thank you. I'll see you next week. It's great to be with all of you and appreciate everybody's work. Have a good day.